Welcome to the Emergency Medical Services Systems Overview. We'll be discussing the development of EMS as it started in the late to early 60s. The Department of Transportation was established, and this system was further regulated and became regulated under the NHTSA, or National Highway Safety and Traffic Agency. They developed a national standard curriculum in 1971, and as it continued to regulate and control and standardize the system, different categories were created as professional roles. It was initially a first responder role that had changed recently to emergency medical responder. There was an EMT, or emergency medical technician basic. There was an emergency medical technician intermediate, which is now changed to become the advanced emergency medical technician. And then the third stage was the emergency medical technician paramedic. These curriculums were continuously maintained, updated, and now based on the national scope of practice, EMS core content and the educational standards are standardized throughout almost all practices, and textbooks follow the same curriculum. The EMS system is a large part of the EMS profession in that it has different levels of licensure and credentialing. We also have different specialized segments within the EMS system. We mentioned the Department of Transportation and NHTSA. We'd like to also notice that there are other federal agencies that come into play. It could be even the Centers for Medicare, or CMS. This also branches down to our state entities. For Hawaii, we have the State of Hawaii Department of Health. Within that department, there is a branch called the Emergency Medical Services Injury Prevention Branch that is an oversight for all EMS services statewide. They mandate the laws that govern the provision of emergency medical services and can contract out these services, including the provision of the 911 service and any services aligned or adjacent to EMS systems delivery, including hospital services, emergency room services, and training. The licensing division falls under the State of Hawaii Department of Commerce and Consumer Affairs. This agency licenses professionals to practice in EMS. Currently, there are only two categories that are regulated and licensed by both state agencies. This is the Emergency Medical Technician Basic. It is required that this professional meet or exceed our state training standard. At the paramedic level is the highest level that is licensed by both the state and recognized by the Department of Health. And this program is also accredited. Period. All individuals licensing for the paramedic level must have their national registry and meet the state required curriculum. As a professional in EMS, one must have a professional attitude and mentality and desired attributes. We would hope that this person has high integrity, empathy, self-motivation, and respect. We know that this course as well is going to be very demanding, requiring you to understand that you develop self-confidence, good communication skills, able to work in teams, and being very diplomatic. It'll ask you to really manage your time carefully. As we continue to learn throughout our program, we'll learn to be patient advocates and deliver efficient and respectful care in our services. Your response activities as an EMS profession is to make sure that you ensure safety of yourself and all those responding to this event. Scene safety is probably the paramount. You will also perform patient care activities at the scene, continue these patient care activities during transfer. You'll also communicate any patient priorities or significant or relevant information to the receiving facility or destination. You will then provide all documentation as far as your provision of services to the patients or patient that you're taking care of, and then return it to service.